Hi everyone, this is Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today we're going to be talking about me, a gynecologist who actually likes treating endometriosis. Now, we know that so many women have gone to their gynecologist and it's a tough interaction. A lot of times women don't feel heard. They're offered treatment solutions that maybe aren't in line with their goals or their values. Now, I want you to know that I feel so passionate about treating endometriosis in a different way. And I don't know about you, but bring it on. I love treating endometriosis. I can help women treat endometriosis without the typical medications and surgeries. And I want to teach you about how I do that. As you know, endometriosis is a gut microbiome disorder, right? And so, what we know about endometriosis is that when we have our menstrual cycle, the blood that escapes from the uterus goes out from the vagina, but it also leaks out through the fallopian tubes. As we know, our intestinal microbiome is a protective collection of bacteria that protects our intestines. But when there's a breakage of that bacterial protection layer, we get this leakage of inflammation that goes down into our pelvis and causes inflammation. And when women have the retrograde menstruation, when they are bleeding through their fallopian tubes as well as their vagina when they're on their period, it causes significant inflammation. There's a lot of videos that I have that teaches this concept more. But importantly, we need to remember that endometriosis is a gut microbiome disorder, and so is any significant stressor or anxiety. Remember, our gut is our second brain. It has just as many neurons as our brain. And so, that being said, whenever we feel scared or anxious, it's going to activate those neurons within our intestines and cause a lot of bloating and diarrhea. And we often see this with irritable bowel syndrome. Now, why is that important? I'm going to tell you about a patient story that I have. Of course, I'm going to protect her anonymity, but I want to tell you about a patient. We'll call her Patricia. Now, Patricia was a woman in her early 30s who's not had children before and who saw one of my colleagues for a consult regarding some endometriomas that she had on her ovaries. They were about 4 centimeters in size, and they were cysts that were on her ovaries that were filled with endometriosis. Now, Patricia didn't have any children, and she was very worried about having surgery to remove those cysts because she was fearful about possibly losing one of her ovaries and it would impact her ability to have babies. That actually happened to me. I lost my right ovary from an endometrioma, so I completely understand what that's about. When she came to see me, we talked about all of the things that cause inflammation that can lead to worsening endometriosis. Prediabetes, too much sugar, stressors, vitamins, avoiding seed oils and lectins and nightshade vegetables and anxiety and job and trauma and all those things. And one of the things that she made a commitment to was to do a low carb, high fat diet. And she was doing awesome. We saw that she was doing therapeutic carbohydrate restriction, avoiding a lot of the things that caused her triggers, which are like beans and potatoes and rice. And she was doing fantastic for about 18 months. She was doing great. She was only needing maybe one ibuprofen on her menstrual cycle. And then eventually she got rid of that. And her endometriosis and her endometriomas started getting smaller. And they became from about 4 centimeters in size to about 2 centimeters in size. And so she was just feeling great. Then she came to see me a few weeks ago. And she was like, Dr. Salcedo, I'm doing everything right, but my last period was terrible. It was super heavy and it was so painful. I had to get back on a bunch of my ibuprofen again. And then we were trying to think, well, it's maybe she was like, I'm doing the diet, I'm doing everything you said. But when we got into it, it turns out that she had recently got married and there was some major family drama that was going on with the wedding. And her mom was really not comfortable with her getting married. And there was a lot of fighting within the family, and it caused her significant stress leading to the wedding and after. So we really got into that, and she was telling me that whenever she has a stressful event in her life, that she feels really triggered, and even something small makes her feel very triggered, and she feels like her emotions become out of control, bigger than what the real problem really is, and she feels kind of embarrassed about that. She feels that she is easily triggered when it comes to any kind of stressors, and she wants to work on that. And so remember, what we know is that when your body feels unsafe, it's going to naturally cause those adrenaline spikes and sugar spikes, so that it activates that fight or flight nervous system to fight whatever threat is in front of you. And so the high glucose goes to your through your circulation to your muscles so that you can fight or flight. But if you can't, or because you're under chronic stress, something that doesn't go away, those stress hormones are going to be elevated. And remember, your intestines are your second brain. And so if it feels threatened, then you're going to get a lot of those same bloating symptoms and discomforts that are related to endometriosis. And so she recognized that. Part of our counseling together was to figure out what the triggers are. And yes, diet is one of them, absolutely. But for her, more importantly, after she was doing all the dietary things and exactly to the T, like I was saying, she started realizing the impact of other lifestyle factors that are sometimes really hard to get into, to really hard to find solutions for. And so when we talked, we actually decided that it was time for her to seek some counseling so she can understand and have really great tools to manage her anxiety, but to manage her emotions when she's undergoing some significant stressors in her life. And that's really important. Remember, women with endometriosis or heavy periods or painful periods, when they come to see us, you shouldn't just be looked at like a woman who's got these problems. You're a woman that has a collection of lifestyle and experiences that come to the table and manifest as medical problems. And so, us as doctors really need to hone in on that. It's easy for us to say, eat better, exercise more, but a woman is so much more nuanced than that. And us as gynecologists, my goal is to really hone in on what are all the triggers that women have. And that's what these videos are about. So remember, I love treating endometriosis because I want to figure out what the root cause is. Sometimes it's not as easy as like stop smoking or stop the alcohol or stop your carbohydrates. It's way more than that. And I'm excited to help you follow that journey. And if you're interested in making a consultation, visit consciousgynecology.com. Go ahead and send me a text or go ahead and call. The number is 840 688 0297 and we'll set you up.